Today I will be talking about Alzheimer's disease in my expert presentation. I will be talking about the causes, effects, and treatment. Starting with a little overview. About 6.9 million people in the United States, ages 65 and older, live with Alzheimer's disease. More than 70%, 75 and older, are evaluated to have Alzheimer's disease according to the Mayo Clinic. Some may or may not know that Alzheimer's disease and dementia may seem similar, but Alzheimer's disease is actually the most common cause of dementia. It all starts with a biological process that starts in the look of a buildup of proteins in the form of a neurofibrillary, tangles and amyloid plaques in the human brain. If you have a loved one in your life, learning about the causes, effects, and treatment of Alzheimer's disease may be very beneficial. So how does it affect the brain? The National Institute on Aging says that the causes of Alzheimer's and vascular dementia can be different for people's brains. There are different forms of dementia, and it is common for people to have mixed dementia, meaning that there is more than one type of dementia within their brain. This can lead to neuron messages between different parts of the brain, and from the brain to the muscles and organs within the body. Throughout the years, there have been many studies that have gotten a better understanding as to what Alzheimer's disease is. But as years go by, scientists have learned more and more of what it is, but also don't fully understand what causes the disease exactly. There is a mild stage, moderate stage, and a severe stage of this disease. Alzheimer's disease really gets better, but people experience greater memory loss and other cognitive difficulties. These problems could be like repeating, taking longer to normalize daily tasks, wandering, getting lost, trouble handling money, and possibly trouble to pay bills. The moderate stage has damage in areas of the brain that control language, reason, conscious thought, and sensory processing. Those 4 areas of the brain can't affect how people correctly detect sound and smells. Most of the time, people who are in the moderate stage tend to not remember who people are in their family and have a hard time recognizing who they are as a person. Paranoia, hallucinations, and illusions can also affect people in this stage. The severe stage of Alzheimer's is the saddest stage of all. The tangles and plaques spread throughout the brain, shrinking the tissue pretty badly. Most of the time, people can't really communicate very well and have to depend on others to help them live. Unfortunately, sooner or later, the person's body will shut down. As people get older, their age is the biggest risk factor for Alzheimer's. So who does it affect? People above the age of 65 usually have an increased risk of developing Alzheimer's and doubles about every 5 years or so. The chance of getting young onset dementia/Alzheimer's is around 1 in 3 people. Sex also has an effect as to who can get Alzheimer's. Twice as many women over the age of 65 have Alzheimer's, as there are still men over the age of 65 with the condition. Typically, women tend to live longer than men, so that is why their chances increase. Men who are 80 still have a lower chance of getting Alzheimer's disease than women over the age of 80. But according to the Alzheimer's Society, there aren't any known exact reasons for this. Genes can also have an effect on a person's chance of getting Alzheimer's. There are 2 types of genes that can affect, called familial genes and risk genes. Familial genes are typically passed down from a parent to a child, and less than 10 out of 1,000 people have this disease because of the familial gene. But typically, the risk gene increases the chance of a person developing this disease. Most of the time, having one of these genes just slightly increases the person's chance of getting the condition. But if you live a healthy lifestyle, especially between the ages of 40 and 65, you are probably going to be less likely to develop Alzheimer's, meaning that you don't smoke, drink, and have a healthy, balanced diet. Being socially, mentally, and physically active can help reduce this risk as well. There are many health conditions that can also increase the risk of getting Alzheimer's, like diabetes, stroke and heart problems, blood vessel disease, high blood pressure, high cholesterol, hearing loss, and depression. As you can see, there are many different roles that can affect the chances of getting Alzheimer's. So, can Alzheimer's disease be treated? And is there a treatment? There are many medications for mild to moderate Alzheimer's disease. There is also medication for moderate to severe Alzheimer's disease. Typically, if you treat some symptoms of Alzheimer's, this can help people with comfort, dignity, and independence for a longer period of time. Here I have my first 4 words bolded. These are a few common medications for the mild to moderate Alzheimer's disease if they show the symptoms. Some of these medications can help cognitive and behavioral systems as well as memory and thinking. People may think that the medication for Alzheimer's disease can be pricey, but Medicare Part B covers part of the cost of them. Here, my last 2 bolded words are different kinds of drugs that can be prescribed for moderate to severe Alzheimer's disease. So, a little bit more on treatment. The FDA has approved many medications for Alzheimer's that fall into different categories. The first category tells us that drugs may temporarily mitigate some symptoms of the disease. This can allow for some normality. The second category changes the disease progression in people living with Alzheimer's. This means that it could have a possibility of slowing down the disease as it attacks the brain of the person. Different forms of treatments can be considered, like a pill or a patch. You should always talk to a healthcare professional to make sure what you use is going to be right for the body of the individual. There are guidelines that need to be observed and followed as well as monitored. Showing progress is always a good thing when it comes to the disease process. Most drugs aim to slow the speed of the disease as it takes over the memory, thinking, and function people have. Some of the treatments remove the protein that accumulates into plaques. When someone allows treatment on a person with Alzheimer's, it's typically in a meaningful way, so that people in the early stages can have more time to participate in life and live more independently. As time goes on, their independence will decrease and cognitive decline, as well as functional decline, will take place. Although there aren't really any medications that can totally take away Alzheimer's, there are many medications that can allow you or someone you know to have 5 more minutes with someone they love. So, how does this impact our society? Alzheimer's disease will always remain one of the most challenging and complex health issues in the world. This disease affects millions of individuals and their families worldwide. There will always be an ongoing research that scientists will continue to do, shed light on mechanisms, emphasizing the importance of early diagnosis and treatment strategies as Alzheimer's progresses with an individual. This is a very devastating condition, seeing as it is happening inside of a person's brain. I believe that we all should prioritize patient-centered care and support systems that empower people and their loved ones due to this scary disease. If you have any questions over this topic, please let me know.